Good afternoon. I want to thank everyone for coming out here today on this rainy day. And I just want some quick introductions before we get started. On the end here, I do have my town supervisor, Cosmo Junta, Chief Chris Mears from the Ogden Police Department. And then these are fellow Gates police officers who are all here because of the urgency and concern that we all have for safety, officer safety specifically. But to give you a little perspective, we're going to talk about mental health today, and we're going to talk about addiction. The two of those seem to go together. I would give you a little update. In the last 48 hours here in the town of Gates, we had a 22-year-old die of a drug overdose, and we had a suicide this morning by firearm. So this is a very relevant topic. It's a very dangerous topic, and it can be a very lethal issue that we're going to talk about. Sending any mental health arrest over to Strong Memorial, the U of R. We have a great relationship with the U of R. I can tell you we are very proud of the services that they offer with the Children's Center over there, the Cancer Center, and of course their emergency room is a level 1 trauma unit that has helped many of our officers fix them up and get them healthy again. So we have all the respect in the world for the U of R. For whatever reason, we seem to be having issues with the psychiatry part of connecting all the dots. And so that's why we're here today. We are going to temporarily take our mental health arrest to Rochester Regional, which is the other healthcare provider in town that provides an emergency department with psychiatric care. And what led to this is an incident that occurred back on Columbus Day here on October 12th. A family here in the town of Gates had a 20-year-old that appeared to be high on some sort of a mind-altering drug, which left him feeling no pain, very agitated, and it was a very destructive manner. That family called 911 to get the police to come as he was smashing multiple windows inside the house. In fact, up to $2,200 worth of windows were broken. The police came. The individual walked away from the police. We continued to engage him in some sort of a dialogue, kind of defuse him. He continued to walk down the street, and he subsequently took off running and ended up on the railroad tracks in town, where we have about 65 trains a day go through there. So obviously that was a very dangerous situation that we were now down on the railroad tracks. So we notified the railroad to stop the trains, and after a brief struggle, we were able to take him into custody. Everybody was fine, nobody got injured. And we transported him, as we normally do, to Strong Memorial Hospital. Upon going to the hospital, we notified the hospital, again, as a standard policy, that we, upon his release, at some point he would be released after his evaluation, that they would notify us so that we could then take him, bring him back to the town of Gates, because we had a plan in place. We would arraign him on some felony criminal mischief charges, get an order of protection for the family, and of course we knew with bail reform that he was going to be issued a parent's ticket. But I think the key part of that was going to be getting the order of protection, the stay-away order, and also our ability to transport him somewhere other than anywhere near that house. Unfortunately, for whatever reason, that fell through the cracks. The police department did not get notified, and I totally understand how busy the U of R is. And I understand sometimes things do happen like that. At some point, we don't know the time frame, again, he arrived at the hospital about 1 o'clock. At 7 o'clock, so sometime between 1 and 7, he got released, and he was released via a taxi cab that came and picked him up, provided by the hospital, and he was transported back to Gates. And he arrived back at that house, and he immediately went down the driveway. He forced open the door into the garage. He then broke out a window on the door that goes into the kitchen and was in the process of kicking in that door when our first officer arrived. He arrived on scene with no backup at that point. People were inside the house yelling, and this was a very volatile situation that was going on. In fact, this was the same behavior that we saw at 12 o'clock and 1 o'clock. The officer had to immediately engage him to tackle him down to the ground. A very violent struggle ensued. The officer was elbowed in the face. He received cuts to his arms and his leg from the broken glass. He lost his portable, he lost his body camera, but ultimately we were able to successfully gained control of that individual. He was put into custody and brought back to Strong Memorial Hospital. And once again, we advised the hospital that if in time, when the time came to release him, to please notify us. We have now additional charges, and our goal was to get him arraigned and get that order of protection. Strong kept him from Monday until Friday afternoon, at which time they did notify us. We did pick him up. We brought him into the Gates Court. We arraigned him on multiple felony charges. And as predicted with bail reform, he was released with no bail. And we did get that order of protection put in place, hopefully to deter him from going back to that address. Let me just step back for a minute and define what a mental health arrest is for those of you that may not know. Law enforcement has a right to take somebody into custody against their will if they are a threat to themselves, a threat to other people, or they are so inebriated or intoxicated that they're unable to care for themselves. That gives us the ability to take them into custody and to bring them to an emergency room. What we specifically in this incident, right, what we didn't have was a comprehensive, a holistic, and a standardized discharge protocol by the hospital, okay? You follow what I'm saying? A holistic, standardized protocol which could have prevented the second incident. And what I mean by comprehensive is, perhaps before we just release somebody, right, we could reach out again to the police, we could reach out to the family who called the police to find out if there's any issues or concerns that they might have before they release their loved one. Without getting into any of the HIPAA stuff, I don't see where that would be a problem to put into some a safe plan in place. And that's what we don't have, that's what we're looking for. Instead, the plan was put him in a taxi cab and he's off their property, and of course we know he ended up back in the town of Gates. So that's what we're here for today, and I've had discussions, some very great discussions over at Strong in the past week talking about our concerns, and the men and women are here. These are the people who are on the boots on the ground and are dealing with those calls. I think my concerns have been genuinely accepted by the administration over at Strong, and I hope some good things come out of this because we want a partnership with Strong. We've been partners with them for years. They're 5 miles from my town. It is perhaps the closest emergency room for us to bring these patients. I just want to give you a little insight to my police department here. I got a population of about 28,000 people, 31 officers. As of today, we are up to 311 mental hygiene arrests, okay? We personally have taken 311 people and put them successfully in a police car or an ambulance, and we have brought them to an emergency room. Last year we did 315 cases. Take the 2 years, we're up to 625 cases where the members of the Gates Police Department successfully took somebody. Nobody was shot, nobody's been killed, and we brought them safely to an emergency department. That's our job. That's the men and women who stand right behind me. I think that's an applaudable accomplishment that we do every day, that law enforcement does every day. In the last couple of weeks, months, we've been vilified as being the force that doesn't know how to handle these calls. I would think that if you look at the numbers, we are very, very successful at handling a lot of these mental health calls. Yes, we do need some assistance, and more importantly, we got to get changes made at the hospital level. That once somebody's brought in there, what's the plan on sending them back into the community so we don't have a repeat situation where an officer gets injured or we go through this all again. Lastly, I just want to talk about a couple cases that kind of highlight just how dangerous these mental health calls are, and to kind of highlight how the system is broken and it puts the client in danger, puts our community in danger, and more importantly, puts my officers in danger. So we're going to talk about this knife up here. That's a 7-inch butcher knife here that you see here. This was an incident that started on July 19th at about 11:30 in the morning. An individual who we believe, based on stuff that we saw at the scene, had used crystal meth. He had smoked some crystal meth. He was hallucinating, paranoid, and he left his house on Spencerport Road with a loaded revolver in his hand, wasn't a holster, and he walked across the street to a plaza that had a grocery store, a bank, a dollar store, a gym. At 11:30 in the morning, he randomly shoots off 2 rounds in that parking lot, and you can imagine the chaos and pandemonium that caused. He then walked back to his house, sat on the front porch in his chair with his gun in his hand, and that's how we found him, the first responding officer. Again, we were able to defuse that, get the gun back, and we took him into custody. Now, this individual was a predicate felon in the state of New York. He had already served a couple state prison terms. That kind of upped the ante on the criminal side, that he has an illegal gun and that he shot that gun off. Our first step after that arrest is to take him to Strong to get him evaluated because of the hallucinating he was doing and the violent behavior. When Strong's done with him, they would then call us. We would then pick him up, bring him back to the gates. We'll arraign him on those felony charges, and hopefully these are charges that can be, bail can be set on. So that did take place, okay? On the 19th, he was brought in. On the 28th, he was, in fact, evaluated and done at Strong. They called us. We picked him up. He was arraigned. The judge sent him to jail with no bail because of his predicate felon status. At some point, and I would imagine because of the bail reform, he was released by a county court judge. And I don't have the facts or how he got out or when he got out, but at some point he gets out of prison. And again, last week, the day after Columbus Day, which would have been October 13th at 5 a.m., he takes his knife here, he goes across the street to that same plaza, he goes into our Planet Fitness with his knife and says he needs help, somebody take me to a hospital. And so you can imagine the pandemonium that created. Another call to 911. We have handed out to you some discs with some of that body cam showing the encounter when the officer arrives on scene and first comes in contact with that individual. He is successfully taken into custody, once again, brought to Strong, and as of today, he still sits at Strong Memorial Hospital. If and when he gets released, he'll be turned back over to us, and an additional weapons charge will be filed for that knife, which is a felony charge. So that's pretty much how the system works, or the system doesn't work. But you know, a lot of questions that all of us have that we go to these calls is, you know, how does this happen, right? How does this happen? You know, when someone gets released, is there any follow-up that takes place? Is anyone monitoring this individual, his mental health situation, right? We don't keep them in jail no more, and it's too bad because, you know, Sheriff Baxter, one of the first things he did was put in place, we had addiction services put in place, and we had mental health services put in place. So when somebody was sitting in jail, they were able to get that help. The problem now is we have 300 empty cells down there, and nobody's sitting in jail. So all those great programs, you know, that Dr. Tish Smith came up with and Sheriff Baxter are just sitting there idle, and they're back out in the community. And so the question becomes, who's watching them, if anybody, and what are the follow-up services so we don't end up with another situation like that. And then lastly, I just got to show you this other one real quick. That was in September. And again, I'm just showing you how dangerous these calls are that we face. Here was an individual armed with a knife, as you can see. We took a still shot, and you know, we successfully disarmed that person and took them to Strong, and everything went very well. This is what we do every day. This is what the men and women who are standing up here do. You know, these are very dangerous calls. Some of these are actually more dangerous than coming across that predicate felon, you know, who you think is going to ambush you, right? Those situations are slim here in Rochester. The Darrell Pearson incidents are very slim. What's not slim are the cases of the mental health and or substance abuse where someone's taken a mind-altering drug and I think our request specifically from Strong is we got to get some sort of a comprehensive standardized discharge protocol in place so that we know where they're going. Are they in a safe environment? More importantly, is the family safe? Are the police safe? Who ultimately have to deal with that if it goes wrong. I would also suggest to you that when we have certain individuals that commit overt acts, right, and not someone who's just saying I'm going to hurt myself, but when somebody actually commits an overt act, like getting a knife, shooting a gun off, destroying stuff, that should be a red flag that we need more attention given to that case than some of the other cases. And again, just to put this in layman's terms, and I'm going to get away from this for a minute. You know, when you think of how a medical patient is treated, right? You go in, you have some arthroscopic done on your knee. They require that you have somebody come pick you up. When you leave, they usually call you again about 8 o'clock at night to see how you're doing, how's the pain, is everything okay, right? There's that comprehensive, holistic follow-up that's done on the medical side. I don't know why that's not happening on the psychiatric side. That's all we're asking for. And again, we love Strong Memorial Hospital. I really hope that we can resume bringing our arrest back over there because, you know what, we have a great partnership, but this has got to get fixed. And, you know, of all times right now, what's going on around our country, you know, there's a lot of spotlight right now on these mental health calls. So at that point, I'm going to just step away here, and Sean O'Mara, who is president of the Gates Keystone Club, which is the union that represents our officers, is going to address you next.
Thank you, Chief. Good afternoon, ladies and gentlemen. Thank you, Chief Van Brederode. Thank you, Chris Mears, for coming as well. I stand here with several men and women of the Gates Police Department. I'm standing here asking for the state mental health system and the New York State bail reform. We need to modify and change the system. We need the help from the state. In order to do that, the state needs to recognize that there's a problem. We as police, we have recognized that problem. We have handled that problem. We do the best we can. We do the best with what we have, and we do the best training. So having that in mind, we deal with repeat offenders on a daily basis. We deal with mental illness on a daily basis. When you add drugs to that mental illness, we don't know what's going to happen. So you've altered that mind. Something is going to happen. Something's going to erupt. First ones that are called are the police. The families call us. We go there to assist. They have to see us taking their loved one into custody, whether it be by force. Most of the time it is. The last incident on Columbus Day, that family had to see us take their son into custody by force. Nobody should have to see that. No parent wants to see their child taken into custody by the police. Nobody wants to see their child being put in handcuffs and put in the back of a police car. So having that in mind, the number one concern right now is the safety of the community. The community is what is the number one concern right now. The state needs to recognize that there's a problem, and that problem needs to be fixed. They need to contact the police officers, work with mental health, work with the bail reform, come up with some kind of modification to the system because the system is not working. These men and women behind me, I've worked with them for many years. We do a great job, and thank God nobody's been hurt dealing with these situations. So having that in mind, we just need the state to recognize and come to an agreement and maybe sit down and sit with us and think, how can we modify the system? How can we change it so that everybody is handled properly? Everybody can deal with the situation and move on. So with that in mind, I'm calling on the state to, before one of my officers gets hurt, before the community gets hurt, because that's the number one thing. We as police, we understand the job we do day in and day out. We understand the risks of that job. We chose this job, and we continue to do this job. So we need the state to recognize again, come and ride with us. See what we deal with on a daily basis. Everybody can sit behind a desk and make decisions, but see what we deal with every day. Come on the jobs with us. That's all we ask. Thank you.
Anybody have any questions?
Chief, so you met with senior officials at Strong?
I have.
What did they tell you? What are they willing to do? Did they tell you?
I think you know, we've had one conversation at this point, and it was pretty much I think a listening post on their behalf to listen to the concerns of law enforcement. I don't think we've really gotten much further than the listening part, and but I'm hoping they go back to their their staff and try to think through the concerns of law enforcement. I am very hopeful, and I believe that they will do that. They are a very professional organization, but I think right now it was just kind of a listen to me vent, and we're still waiting for some suggestions.
So, Cole's not going to go to regional, Rochester Regional, or Unity, or General. Do they do something? What do they do different? Do you know?
You know, first of all, it's been a while since we've used Rochester Regional, because when the merger took place with Park Ridge or Unity and Long Pond, we used to bring our mental hygiene arrest over there. They then said bring them all over to Portland Avenue, so we stopped using them because of the distance involved. About 3 more miles, but you got about 42 more traffic lights to get over there. You know, I don't know exactly what we're going to find over there, but one thing I can tell you what doesn't work, and what doesn't work is going to Elmwood Avenue. So we're going to roll the dice, and let's hope that Rochester Regional has a better discharge plan in place, and are more prepared to handle this.
You say you want to see a more standardized protocol at Strong. Do they have anything in place right now? Is it just something that isn't working, or what do they have in place?
Well, again, you know, I had a conversation with them, and the information was kind of minimal that was given back to me, and I understand their concerns, you know, to not want to reveal too much. I don't know what their protocols are. I really don't know. And that's one of the problems with the whole mental health system, right? It's the system of we don't know, right? Because you got HIPAA laws involved, confidentiality laws, and it's hard to navigate or to get information on what exactly takes place. I don't know their protocols.
Do you think this is more of a system issue as far as hospital system, or is it more of a state issue? Just dealing with all the laws and sure they have to follow.
Well, it's obviously, you know, I think a systems issue within the hospital, but I also think the state of New York could require or mandate that there has to be some sort of a safety net plan in place. Down and talks to that person, you know, who lives with you? Do you have an emergency button, right? They do a whole background check before they send that person back home so that they're safe. And again, why that doesn't happen on the psychiatric side, that's what we're trying to figure out, and the addiction side. The two of these are pretty much the same.
So Chief, when your officers drop this person off at the hospital at Strong, they checked a box saying we want to be notified when this person was let go, and they told them that verbally. Is that what you're saying?
Yes, both occurred, yeah.
And did Strong notify you when they let him go?
No, in this situation on the 12th, they did not know.
Any reason why? Any explanation as to why they wouldn't contact you?
Again, you know, there was no, they gave me no explanation other than it didn't happen, and they listened to my complaints.
Is this the proverbial straw, these instances? Has it been going, you mentioned about 600 instances that went well. Have there been sort of problems with what you moved before, but this was just sort of just at the end of the line until you get ready for something now?
Good question. So I've been on the job for 35 years, and I can tell you that my whole 35 years, this has always been an issue with mental health arrest. It just became, well, that's the way business is. Until recent events around our country. And now, you know, because of the ramifications of that, we're saying, you know what, it's no longer going to be acceptable. This is how business is. But I can assure you, we've had lots of incidents documented where people were brought to an emergency room, evaluated in 2-3 hours, released. And I literally worked a case here in the town of Gates where at 11 o'clock, I brought the person to a hospital. They were mental hygiene, and by 3 o'clock in the morning, they took a cab. That seems to be the popular discharge. Went to the driving park bridge and jumped off the bridge. And now I got a call from RPD to say, I want you to go back to that house. Now you got to go tell the family that he jumped off this bridge. So, look, we've been dealing with this for years. That this whole issue of okay, once they're released, who's watching? You know, do we do any follow-up? Who makes those calls? Who checks in on them to make sure they're doing okay? This has been going on for years, but we're at a situation now in our country where, you know, law enforcement's not going to take the hit for this.
Have you spoken with other police departments to see what their protocols are, if they've changed or what they do?
As far as I know, I'm the only department, and I totally understand that, and I understand, you know, I've had first-hand experiences, and my staff, you know, is very disappointed in what happened. And so I'm probably the first to take this move and to come out with a statement like this.
So, as president of the Chiefs Association, do you have more, I don't know, weight on this with other than Chief Mears is here, but president of the association, do you have more influence than just if you were only the chief of just one department?
I think the reaction I've gotten from Strong Memorial Hospital has been very positive, and I think one of the reasons why they have been very cooperative in reaching out to me is perhaps because of that title, that I am the president of the Chiefs Association. But today I am just standing up here as the Gates Police Chief, and my neighbor, Chief Mears, came over here to support me. But you know, we own this one, and this is our situation, and that's why we took that action that we believe is necessary to safeguard my officers as well as the community. All right, thank you very much for coming.